It's really critical for patients to act as their own advocate when they're diagnosed with pancreatic cancer.
I was diagnosed with pancreatic cancer in November of 2008. Right after I was diagnosed with pancreatic cancer, I did the research and found out that I needed to have the operation right away. And I tried calling everybody I knew within the healthcare system and see if I could rattle some cages and get a sympathetic ear in terms of moving my operations up the queue. I was in the hospital for about 3 weeks, and in walking the halls I was fortunate in stumbling across a flyer that advertised the Pancreatic Cancer Action Network.
Through the PALS program at the Pancreatic Cancer Action Network, we can provide information to patients so that they can take a more active role in knowing what is going on in their cancer treatment.
Oftentimes I call them to find out what is the best course of action to take as to diet, what course of action should I be taking in the chemotherapy, and if there's any alternative, other than chemo out there.
With regard to complementary and alternative therapies and medicines, it's very, very important to have open communication with the physician regarding those types of therapies. In some situations, those therapies can negatively interact with other conventional cancer treatments.
In my experience, I found it's very important in working with the doctor, letting him know as to what I've been taking and to include the doctor in the decision making.
Well, for me personally, I thought it was confusing to do a lot of research on the internet. So there's good information on the internet, and there's also very confusing and actually incorrect information on the internet. I think it's important to think through what you've heard and make a written list of what you need to know, what you want to know, what you don't understand.
It's also important to let your doctor know when your treatments for your side effects and symptoms are not working, because that way the doctor knows that he needs to change the treatment plan so that your side effects can be better addressed.
I had probably about 3 or 4 different nausea drugs till they're able to find one that my system could tolerate and that worked for me.
A lot of patients come to me with limited understanding of their disease. And I always try to spend a little bit more time in our first visit. After all, in a quick visit, I might have 10 or 15 minutes with a patient, maybe 20, and 10 or 15 minutes have to be dealing with the symptoms associated with chemotherapy, dealing with the blood counts, talking about the next dose, and I can miss a whole lot of important questions.
So it's important to know what you need to know, what your concerns are and what your questions are, and to write them down so that you make sure that before you leave, you've covered all those questions. And I think that not only serves the patient, but does serve the doctor as well.
The Pancreatic Cancer Action Network has a wonderful program called Patient and Liaison Services, or PALS.
The PALS program is a very valuable resource for patients when their doctors don't have enough time or extra time to answer their questions.
We have trained staff members here in our office. You can call in, you get connected to a PALS associate, and that PALS associate is able to answer any questions that you may have.
Something that may be helpful for patients is to keep a list of questions that they have for their doctor. There's often long stretches between appointments, and so writing down those questions can help the patient remember them when they go to their next doctor's appointment. It can be helpful for patients to keep all of their medical records and information in a binder with different sections relating to different topics. Some of the sections of that binder may include a list of medications that the patient is on, their medical records, symptoms that they're experiencing, and even a pain journal.
And make sure that you go through all that information when you're talking to the doctor, because not only is it incredibly important for the patient to have that information, but doctors really do want to do their best. And if they don't know how we feel, and what our questions are and what our concerns are, then they may not be able to provide the best care either.
The Pancreatic Cancer Action Network recommends that patients get a second opinion. We also recommend that patients see a specialist in pancreatic cancer.
People can get tips about staying organized and advocating for themselves from the PALS program at the Pancreatic Cancer Action Network.